IVM.
Doctor, can you share what are the symptoms that we should be looking at? Like before the podcast, you were talking about it being a spectrum, that there is at one level there is snoring, but at the other level there is extreme sleep apnea. What are the symptoms that we should be looking for, or how should we start diagnosing ourselves before we come to a doctor?
Yeah, so one is simple snoring, where a person is snoring but he is waking up fresh. He is not disturbed himself. He's only disturbing his spouse or the bed partner.
The other people are not sleeping.
Absolutely. So this condition is quite common. Almost 40% of the males in their 40s do snore.
Correct.
But if this is happening in small kids, kids should not be snoring also. They are unable to complain about their freshness. So if some child has a snoring, it should be looked into.
Can I pause you here?
Yes.
What is the difference? Why has age got to do with snoring? What happens? Something that degenerates that is causing snoring? What causes snoring?
Very, very nice question. See, up to the age of say 12, 13, male and female child is almost similar because the hormones have not played a role. After this age, after hitting puberty, males develop in a different way. Their soft palates are longer. Generally, their throat is longer than the females, and that's the cause of snoring in males.
Okay.
That's why males do snore more. So, if a child has a snoring problem, it has nothing to do with the gender. In old age, the muscle tone goes down. Therefore, older people start snoring. Again, a child does not have anything to do with the age. So now it is not gender related, it's not age related. If the child is snoring, there has to be some problem in the
Pipe. Yeah.
airway. There is some obstruction. So tonsil adenoid enlargement or a crooked nose or something like that, or allergies. So which is always treatable. Therefore, if a child is snoring also and is not stopping to breathe, still that is something which needs to be taken care of, medically evaluated. Now we come to the other aspect, sleep apnea, which we already discussed, that if a person is stopping to breathe, then you can witness it. Right? You can see, observe in the night. There's even no need to do the sleep study. Like you said, your friend watched her husband choking. That's a witnessed apnea. That's the most important sign of diagnosing sleep apnea. There are other things. There's some 12 questionnaires in market.
Okay.
You can go through them. But if you witness apnea, that is the most important. Now we come in the between. The most common thing, upper airway resistance syndrome. Now, don't get carried away by these heavy words. Upper airway. This is the upper airway.
Right.
We have an airway which goes from the nose till the lungs. Upper part of the airway is nose and throat.
Right.
Resistance, that means there is a resistance to the flow of air. And syndrome, that means the person is snoring and getting up tired, not being fresh. This is the commonest problem that you have to diagnose. So if a person is complaining of being tired, or you see that he is tired, he is not able to sleep well and is disturbed in the night, he does not get fresh. These are the people who need to be evaluated medically as well, because half of the world's population has a crooked nose.
Right.
Half of the world's population has a deviated septum, which may or may not be significant. And 25% of the world's population has got allergy. So combined, you have almost 2/3 of the population who is at risk of having some kind of resistance in the nose and the throat.
Right.
This can be tackled. That gradually will lead to obesity because they'll not get up fresh and they'll feel like eating something. Many people cannot sleep well and they go on binge eating.
Correct.
Like in the night, they cannot sleep well. They get up at 4 o'clock in the morning, they are unable to sleep well, and they take out something from the fridge and eat.
Absolutely.
So that itself leads to obesity and the hormones. So that will further lead to sleep apnea. So if we understand the whole spectrum, then we can pick up people who need evaluation and evaluate them.
So what is the process of somebody who wants to evaluate themselves of sleep apnea? Like what kind of doctor do they go to first? And what is the process that normally follows?
Correct. So to understand that, we have to understand where is the problem.
Right.
Problem is in the nose and the throat. So we have to get it evaluated by a ear, nose, throat doctor, naturally ENT surgeon.
Right.
Unfortunately, not many ENT surgeons are having interest in this
Sleep
subject.
apnea. Okay.
They are not trained for this.
Hmm.
For the last 12, 13 years, we have been trying our best. We have an organization called Indian Association of Surgeons for Sleep Apnea, of which I'm a past president. We are trying our best to train ENT doctors, but ENT doctors are the first one to evaluate if there is a problem in the nose and the throat. And nowadays, the scanners, the CT scanners are being very, very common. Everywhere you have a CT scan, it's very easy to scan the nose and the throat. In fact, in-clinic CT scans are also becoming common. So endoscopy is becoming common. So even a clinic evaluation can tell you everything about the nose part. Now, snoring part, we do the sleep study. Sleep study can be done by any physician or even by the companies that actually are doing home sleep studies. So you can just go online, get to a company called RestMed or Philips, and they can ask for a sleep study, which can be done at home and which is pretty reliable for most of the cases. For screening, you can actually do a sleep study at home.
Okay.
You don't need to go to a sleep clinic and sleep over there. You can do it in your bedroom.
So it's easy now.
It's very easy, and the cost is say $2,000, $3,000. So it's not very costly. Also, it's affordable. So you can do a sleep study at home, and once the sleep study shows that you have got sleep apnea, we evaluate by a procedure called sleep endoscopy. So we put you off to sleep, put a small endoscope in the nose, and go to the throat, which part of the throat is actually collapsing. That's called sleep endoscopy.
Right.
So this becomes a little specialized investigation, which is done by few doctors. But the part prior to that, a CT scan, the routine evaluation of the ear, nose, throat, and the sleep study can be done even in your neighborhood and in a very easy way.
So at home, how do they do the sleep evaluation? Is it a...
Yeah, so they come with a small machine, which has got a sensor for the oxygen saturation, your breathing. So they put a sensor here. So the evaluation of breathing is happening. Then they put a sensor on the chest so that the chest movement is recorded, and they put a sensor on the finger.
Okay.
Only 3 sensors. So you can easily sleep with them. You can go to the washroom. It's called a limited channel sleep study, which is good enough for a screening purpose.
Right.
And I sincerely recommend, if there's any doubt or suspicion of a loved one having sleep apnea especially, then this should be done at home.
This should be done immediately.
ResMed, I think, is the leader in this segment world over.
Okay.
And they have a pretty
They
number
send a kit home, or somebody comes and shows?
Somebody comes home and does
Somebody
it.
comes home and does it.
At least in our country, it's very easy.
Right.
In the developed countries, they send a kit home.
Okay.
You do it and return it to them. In our country, because we have a lot of people to work for, the boys go home, they put the machine properly, and they collect it in the morning. It's very easy.
Okay, so if you enjoyed this episode, I want you to do 2 things. The first is make sure you send it to 3 friends so that they can enrich their life as well. The second thing I want you to do is I want you to subscribe so you know when future videos and podcasts come out. Now, if you want to follow us, we are at IVM Podcasts on Instagram, Twitter, etc. If you want to follow me, I am at Ashdin Doc on Instagram, Twitter, and everywhere else. You can also check out my books. They're available everywhere. Change Your Habits, Change Your Life, The Book of Good Habits for Kids, and 1 Habit a Day. Check them out now.
IVM.